Hi, I'm Shinur Amin, and today we're going to talk about tremors and some of the clinical features of tremors. So the first topic we'll talk about is essential tremor. So essential tremor is the most common movement disorders, affects approximately 5% of the population. So we have 5 to 10 million people in the United States alone or Western Europe that are affected. It's characterized by a high frequency tremor present among those that are aged above 70 years old. It predominantly affects your upper extremities, so your hands more. It is a high frequency tremor, so we're talking 6 to 10 hertz, pretty fast. In contrast to Parkinson's disease, which has a low frequency rest tremor. It is a bilateral tremor, so whereas Parkinson's we have a unilateral one side tremor, like maybe there's the right hand and the left hand is okay. In essential tremor, we get bilateral movements of very high frequency tremors. There is, for those that have very severe essential tremors, you can get that overshoot of the movement of the past pointing, which means there could be some cerebellar issues as well. Interestingly, we still don't know why, but alcohol seems to improve essential tremor in many cases, which is why there's a tendency to self-medicate by those patients that have essential tremor. It could lead possibly to alcohol dependence and other, associated symptoms of alcohol, which is a whole nother issue. It gets worse with stress, and you can have impairments of your walking and disturbances in hearing and cognition as well. So we talked a little bit about what differentiates essential tremor from Parkinson's disease. Other things are that PD stops when you start doing voluntary movement. So you'll have this rest tremor, low frequency tremor, but it gets better as you try to do something. Whereas, at least initially, okay? Whereas essential tremor, it gets worse actually as you try to do something. Okay, you still, and with Parkinson's, you get that, traditional symptoms of bradykinesia, rest tremor, like we talked about, rigidity, especially the cogwell rigidity, as well as postural instability, so a lot of frequent falls. One of the things that you can find among essential tremor patients is that as they try, if you give them something to write, they'll start writing, and then they have pretty large handwriting. Okay, so as they write, they'll have a tendency to write pretty large letters with their hands.